Do you feel another UTI coming on?
Hey friends, welcome to the Cozy Catch Up where we talk about health, happiness, and living your best life in your 40s and beyond. I'm Leah.
And I'm Stephanie, and we're diving into a topic that many of us have been through but few of us talk about in public, the urinary tract infection or UTI. If you've ever felt that sudden, intense, I need a bathroom right now feeling, followed by that sharp burning sensation, you are definitely not alone.
Seriously, this is so common. We're talking about over half of all women experiencing this at some point in their lives. A UTI is just a general term for an infection in your urinary system, most commonly the bladder, and in scientific terms, it's called cystitis. Today, we're peeling back the layers to understand why it happens, how it feels, and what we can do in our daily lives to support our health.
Stay tuned. By the end of this episode, we'll give you 3 ways to prevent UTIs you can start today that you can fit into your everyday routine. If you ever had a UTI, hit the like button below. Let's see how many of us are in this club. Although we are registered nurses, this podcast is for informational purposes only. Always check with your doctor before trying anything new. When we talk about UTIs, we're mainly talking about a type of bacteria called E. coli. It finds its way into the urinary tract system. So why us? Why are women so susceptible to UTIs?
Well, it largely comes down to our female anatomy. Simply put, our urethra is shorter than a male's. That means the bacteria has a very quick commute from the exterior right up to the bladder. The opening is also naturally close to the rectal area, which is where those bacteria like to hang out.
There are some risk factors that can cause a UTI. So one of them is intimacy. For many, sexual activity is a factor, as friction can move bacteria closer to the urethra's opening. There also can be life changes, things like menopause, where hormone levels like estrogen can change. It can shift the natural balance of protective bacteria.
There's also birth control with certain types of contraceptive methods like spermicides that can also impact the protective flora in that area. And then there's also a fluid factor. We know it sounds simple, but not staying hydrated can mean bacteria linger in the bladder longer. So make sure you're staying hydrated. All right, so let's be real about the symptoms. It starts with that urgent, persistent feeling that you always need to go, even if you just went. Then comes this burning pain when you go pee. And then often you pass very little urine, or your pee looks cloudy or smells funky. You might even feel that dull pressure down there in your pelvic area. So those are signals that's telling you that you need to check in with your healthcare provider right away.
Yeah, I remember this one time I was wearing really tight jeans. They were really cute, but they were uncomfortable. They were tight. So I went the whole day, and by the end of the day wearing these jeans, I had a UTI. I mean, it just constricted and it wasn't comfortable. But yeah, I suffered because of the tight outfit that I had on. So the physical discomfort is one thing, but the emotional side, especially with recurring UTIs, it's so exhausting. When they keep coming back, it can start affecting your mental health.
There's a lot of anxiety around intimacy, the frustration of missing work, or the simple stress of always needing to know where the nearest bathroom is. It's a huge strain on your lifestyle.
Yeah, we get a lot of calls at the call center about UTIs, and a lot of people are frustrated when they call because they get them so often. And this actually shows how common UTIs are. It's actually one of the top calls we get as advice nurses. If you feel one coming on, be proactive about your health by seeking care.
I remember getting a lot of those calls, and I totally understand the frustration these women feel, especially if they have chronic UTIs, because I've had chronic UTIs before. And it's not fun taking antibiotics all the time. So I asked my doctor to refer me to a urologist. And the urologist ended up examining me, and he said I was totally fine. So I went back to my doctor, and he discovered that my vitamin D level was low. Vitamin D is something that's important because it boosts up your immunity. It helps with your immune system. So he put me on large doses of vitamin D. And, after that and maintaining my vitamin D levels, it seemed to have helped with my UTI symptoms. So I haven't had any UTIs in a long time, in years actually. So I'm really happy about that. Yeah.
Wow. I'm glad you found the culprit, right? I never thought of getting my vitamin D levels checked. So that's good that they've lessened over the years.
Yeah. So there is hope for women who have chronic UTIs. You can talk to your doctor about it. There could be something that you might be deficient in, or it could be a lifestyle change. So check with your doctor.
So we want to hear from you. What's the most frustrating thing about dealing with a recurrent UTI? Drop a comment below and share your story. You might actually help someone dealing with the same thing.
All right, so here's some quick steps that you can take action on. So when those symptoms of discomfort hits, your next step is to call your healthcare provider. This information is just general overview of the process. It's not medical advice, okay? So getting to know your diagnosis, they'll usually ask for a urine sample. They'll check this sample and see what's going on and what kind of bacteria might be causing the trouble. So once confirmed, a provider will typically prescribe a course of antibiotics to knock out that bacteria.
So you want to know the red flags, right? It's super important to know that if the infection travels up to the kidneys, it gets more serious. You can actually get a kidney infection. So look out for things like fever, chills, or pain that you start feeling in your lower back, called the flank area. So if you see any of those, seek medical attention immediately. So now for the good news. There are a lot of simple ways and practices that we can adopt to support our urinary tract health and potentially reduce the risk of getting a UTI.
Here are 3 wellness habits you can start right away. Number 1, sip and flush. Stay well hydrated with water. It helps keeps things moving and it flushes out your system. So staying hydrated, drinking plenty of fluids, and urinating throughout the day helps flush out any bacteria. Number 2, the golden rule of wiping. Always wipe front to back, never back to front. And that's the easiest way to prevent E. coli or any bacteria from going from your rectum into your urethra. Number 3, the post-intimacy habit. Many people find it helpful to urinate right after sex to help clear the urethra.
Remember, taking care of your urinary tract is a crucial part of self-care. Be kind to your body, listen to what it's telling you, and please never hesitate to call a professional if something does feel off. So as promised, here are 3 ways to prevent UTIs from starting. The first one is to try supplements for prevention. So cranberry supplements, juice, there's D-mannose, azo, or probiotics that can effectively manage and prevent urinary tract infections before you have one. A combination of these may be beneficial, but none are a substitute for antibiotics or medical treatment themselves. Okay, so if you already have an active infection, taking cranberry pills or D-mannose will not get rid of it. You will need antibiotics for that.
Yeah. The second way is to use the right type of soap if you do use a feminine wash. Feminine washes are formulated to be gentle and pH balanced for that sensitive vaginal area. Traditional soaps can be really harsh and strip the skin's natural oils. And these soaps can have fragrances that disrupt the natural pH balance, potentially leading to irritation, dryness, or infections like UTIs. So if you are going to use a soap, use a feminine wash that's pH balanced and fragrance free.
The third way is to stop wearing tight-fitting pants. So wear breathable clothing, loose cotton preferably. Wearing a lot of tight clothing can increase the risk of UTIs because it traps the moisture and the warmth down there, which can create that ideal environment for bacteria to grow. So doing this can help prevent bacteria from multiplying and you can reduce your UTI risk. If you want more information on UTIs, we have an ebook available. Just click on the link below.
Your health is your wealth, and we want to see you living your best, most vibrant life free from the pain of UTIs.
If you learned something new or found this information helpful, share this video with a friend. Hit the like and subscribe button below so you don't miss out on our next wellness topic. Thanks for joining us. Till next time, bye.
Bye.